TGIF, Colin here with another Flashback Friday episode of the Patient Attraction Podcast. Now today, I want to revisit a Friday podcast episode from back in August of 2014, where we talk about three things that patients want from their dentist and how giving them these three things makes them more willing to pay, stay, and refer. Watch to find out exactly what I'm talking about right now. Colin, receiver here, TGIF. We've been crazy busy here at SmartBox as more dentists see the kind of value we provide with our industry-leading patient attraction system. But frankly, those dentists aren't signing up with me to help me reach my financial goals. They're not paying me because they like me either. They have things that they want from me, and they pay me because I deliver those things to them. When we come back, I'm going to tell you what patients want from you and why they're willing to pay you when you deliver. Stay tuned. Today, I want to talk about one of my biggest pet peeves with dentists. It's the belief some dentists seem to have that as soon as they open their doors, patients are just going to start scheduling appointments. It's as if these dentists are entitled to patients. And I'm going to say it again. Patients don't care about you. They don't care about helping you get more freedom. They don't care about helping you get more financial stability. They don't care about helping you sell or franchise your practice. Those are the things that you want. Here are the top three things that patients want. Number one, they want a dentist who's going to solve their problems. Not someone who is using them to solve their problem, which is a lack of enough income. We call these pain points, and we emphasize them in all the marketing that we're doing with our clients. Pain points are essential to the kind of patients you want to attract, because if you're going to fix their problems, the problem they have is a pain that they have. Now, this could be a literal or a physical pain, depending on what kind of patient you're trying to attract. It could be the pain that they have in that abscessed tooth, or it could be the pain they have of not being able to eat the foods they love anymore. We talk right to the patients about his or her problems, and that sets the dentist up as the provider of the solution. Number two, patients want a dentist who's going to prescribe the best clinical solutions. They don't want a dentist who's just going to keep trying to upsell additional products. If you remember our series a couple of weeks ago, dentists prescribing treatments patients don't need was the number one complaint among patients who gave negative Yelp reviews. Now, we're going to talk about that in a later podcast about ways to deliver treatment options that garner trust and loyalty. Number three, they want a dentist who gives them time to consider their options, which can be a pretty big expense and an even bigger life event. If you're a dentist that's doing complex reconstructive dentistry, your patients are going to have a sales cycle that might last from 3 or 4 months to 18 to 24 months. You might hear from them 3 years down the road after they just got an inheritance from somebody that passed away, and now they're ready to move forward. They have the ability to move forward with the treatment. What they don't want is someone that's going to pressure them with limited time and decide now or it goes away offers. And we've done some secret shopper tests with some of the large franchise dental implant centers, and this is the method that they push. I make it a practice never to succumb to that kind of sales pressure. I think people spot those kind of salespeople from a mile away. If you can give me that 15% discount today, you're going to give it to me when I call you next week too. And it's frankly unfair to tell someone they need major dental reconstructive work, teeth pulled, surgery, etc., and then ask them to make a snap judgment on whether or not they want it today. And, like I said earlier, you're talking about big sums of money that people are going to think about. They're not going to make decisions today. Sure, every sales method tells you lose a big percentage of customers if they walk out the door without buying or committing to buy. But you'll get higher case acceptance and less buyer's remorse and fewer Yelp complaints if you don't put the pressure on the buy. I want to talk about keeping your name in front of these patients. There's a difference between pressuring patients to buy and keeping in touch with them as they move through the sales cycle. And if you're not following up with these prospects that are coming in, you're losing out on what the National Sales Executive Association says 90% of your big case sales are going to close on the 7th to 12th touch you have with that prospect. So if you're not touching and reaching out to your patients 7 to 12 times, you're losing out on a significant portion of your sales. How do you touch patients that often? Give me a call. I'll be glad to share it with you. Tomorrow, I'm going to tell you about why you shouldn't be embarrassed to ask for $10 or $15 or $20,000 for a major case. Until then, keep moving forward.